This lesson will focus on recognizing the difference between goals and objectives and how to prepare objectives accurately. It will also help us define the domains of learning and how to develop teaching plans that utilize these domains effectively. A goal is defined as the final outcome of what is achieved at the end of the teaching learning process. And an objective is a behavior describing the performance that learners should be able to exhibit to be considered competent. An objective is a specific, single, one-dimensional behavior. The difference between them is related to time and their level of specificity. Objectives can be further broken down into educational objectives, which identify intended outcomes of the education process with respect to the program itself, or instructional objectives, which describe teaching activities and resources that aid learning. Behavioral learning objectives are specific, short-term behaviors that are action-oriented and learner-centered. Bloom's taxonomy orders these specific behaviors according to their type and complexity. The differences between goals and objectives can be seen on this slide, with goals being global, broad, long-term, and multidimensional, and objectives being specific, singular, short-term, and unidimensional. Setting goals and objectives should be mutual between the teacher and the learner, must have a buy-in, and should blend what the learner wants to learn and the teacher wants the learner to know. Disadvantages of using behavioral objectives include that they are time-consuming to set, may not be inclusive or creative enough, therefore not allowing for flexibility, may be more teaching than learning-focused, pedagogic, or overly simplified, reductionistic. Advantages include they focus on the learner, help learners stay on track and teachers organize content, tailor teaching to learning needs, and communicate to learners and the healthcare team what is planned for learning and teaching. Well-written objectives help teachers select and design content, methods, and materials, give learners clear statements about what is expected, and assist teachers in being able to measure learner progress. Behavioral objectives have 3 important characteristics. 1. Performance, which is what the learner is expected to be able to do. These can be visible, such as writing something down, or invisible, such as recalling information. 2. Condition, which describes the situation where the behavior will be observed. And 3. Criterion, which describes how well or with what accuracy the learner must perform. A 4-step approach should include the testing situation, such as, quote-unquote, a 50-minute 6-question math test without a calculator, who will perform, such as, quote-unquote, a trigonometry student, what the learner will demonstrate, in this case, quote-unquote, will solve and complete the test, and how well the learner will perform, such as, quote, complete successfully 5 out of 6 math problems. The ABCD method proposed by Smaldina, Lawther, and Russell suggested the 4 elements in writing behavioral objectives include A, audience, the who, B, behavior, the what, C, condition, under what circumstances, and D, degree, or how much or to what extent. Common mistakes in writing objectives include subjective rather than objective interpretations of performance, using multiple behaviors in one objective, and focusing the objective on the teacher, not the learner. Writing unrealistic goals or objectives unrelated to the end goal, or making the goal too general or too cluttered so that the outcome is not clear. Behavior can be defined as to type, domain, and by complexity, simple to difficult. The 3 learning domains are cognitive, the thinking domain, affective, the feeling domain, and psychomotor, the skills domain. Levels of behavior in each domain are described from simple to complex, with various verbs describing behavior at each level, and can be found on page 357 of your text. Teaching in the cognitive domain is the most traditional way to teach and consists of lectures, one-on-one instruction, or computer-assisted instruction. It is often the prerequisite of teaching in the other domains. Teaching in the affective domain involves the learner's attitudes, feelings, and beliefs, and helps internalize the behavior. Methods include group discussion, role-playing, role modeling, simulations, and questioning. Adjusting teaching to incorporate the patient's values, culture, and beliefs is very important and often underestimated. Teaching in the psychomotor domain or the skills domain includes demonstration and return demonstration, simulations, gaming, and self-instruction, and is designed to help the patient acquire and improve fine and gross motor skills. Repetition is important at this stage as it allows the patient to focus on this domain without unnecessary questions or distractions. Factors that may influence psychomotor skills include the patient's readiness to learn, motivation to learn, past experiences, current health status, environmental stimuli such as distractions in the environment, anxiety level which interferes with learning, developmental stage as previously discussed, and time committed to practice. When developing a teaching plan, goals and objectives should serve as the blueprint and should be mutually agreed upon between teacher and learner. The three main reasons to construct a teaching plan include: 1. It ensures a logical approach to teaching and keeps learning on target. 2. It communicates in writing an action plan for the learner, teacher, and other providers. And 3. It serves as a legal document that indicates a plan is in place and how much progress is being made. The 8 basic elements of a teaching plan are the purpose, the why of the educational session, the overall goal statement, the list of objectives, the outline of content to be covered in each teaching session, the instructional methods to be used, the time allotted for teaching of each objective, the instructional resources such as equipment or tools needed, and the methods to evaluate learning. Internal consistency is the major criterion for judging the integrity of a teaching plan. Internal consistency is the major criterion for judging the integrity of a teaching plan. It must make sure the 8 elements relate to each other and are in a consistent domain. If there are multiple domains to be accomplished, then the goals and plans must reflect each of these. Learning contracts are written or verbal plans that are an agreement between the teacher and learner about what specific learning activities are to occur within a certain time frame. Its purpose is to encourage active learner participation and to improve communication. The 4 components of a learning contract are: 1. Content, which specifies the behavioral objectives. 2. Performance expectations, which specify the conditions by which learning will be achieved. 3. Evaluation, which specifies criteria by which competencies are judged. And 4. Timeframes, which specifies the length of time for successful achievement of objectives. Learning curves show the changes in psychomotor performance at different stages of practice, as depicted in 6 stages as seen on pages 371 and 372. Setting appropriate goals and objectives begin with assessing the learner and writing clear, concise objectives that serve as a guide to plan, implement, and evaluate the teacher learning process.